Hello, I'm Dr. Michael Fossel. I'd like to welcome you all to this conference. This conference is about aging and health, disease and freedom from disease. It's about today's medical knowledge, and it's also about tomorrow's possibilities. It's about our ability to improve human life. I've been invited to give a perspective, both conceptually and historically, on aging and age-related disease in order to help map our way into the future. Rather than looking at aging from a strictly linear perspective or 20th century perspective, I'd like you to join me as we take a jump fully into the 21st century. Let's not look at current technical innovations, but follow me as we consider something far more important than mere technical innovations. Let's look at what we think of as impossible. In short, let's look at our future. I'd like to offer two intriguing questions for all of us. The first will sound too simple, and I think the second will appear impossible. But if we keep an open mind and think carefully, I think we'll discover that our two questions are neither simple nor are they impossible. The first question, the one that sounds misleadingly simple, is what is aging? Most of us think we know, yet it's so easy to think that a simple question has a simple answer. And if we already know, then why should we look any further? Why indeed? The second question, the one that sounds misleadingly impossible, is can we reverse aging? Most of us, without realizing it, think we can't. Yet it's so simple to think that since we never have, we never will. But perhaps we can do more than merely slow aging. Perhaps we can actually reverse it. Why not? Seriously. How do any of us know what can't be done? What is the impossible, but a refusal to step back and carefully re-examine our assumptions? So since this is a keynote for an interesting conference full of very interesting people, let's see if we can take a look a little bit deeper. Very few of you probably were practicing medicine when I was back in the early 1980s, but one of our assumptions in those days about what was impossible had to do with ulcers. We assumed that ulcers were a matter of acid and stress and gave not a thought to anything further than that. It was that assumption of understanding that misled us. And it wasn't until 1983 with this Keach journal paper in the British Medical Journal by Robin Warren and Barry Marshall that we began to understand that it was Helicobacter pylori, seen here on the right, that was the etiology of, for example, pyloric ulcers, resulting in them getting a Nobel Prize for this in 2005. But again, the problem was not that we were ignorant. The problem was that we assumed we already understood the disease. And it's a mistake we make commonly. Here's another example of this. This is a quote from a friend of mine, Len Hayflick, who was the very first one to ever describe cell aging. And what Len is saying here in the discussion he and I had a few months ago was that we all assume that age-related disease has the single greatest risk factor of aging, but then we entirely ignore aging itself and we focus on the disease. So rather than understand the actual process of aging, we simply make the assumption we know it and move on to the disease and narrow our focus, which is a mistake. Nor is it the first mistake we've made historically. This is Galen, some 2,000 years ago. And on the top, you see this quote from this conference: cells and aging wear out, resulting in aging. Now, this is a description of aging. And Galen himself could have described accurately the Antonine Plague, but he didn't understand what caused it. These are quotes of his: fever, diarrhea, pharyngitis. He talked about skin lesions. And his descriptions were quite accurate for the Antonine Plague, but they were not an explanation of the plague, nor could he have been able to understand microbial disease. Again, he had an assumption of understanding. Here is the kind of thing that happened a bit more than about 1,500 years ago, actually, in Japan, with a major smallpox epidemic that wiped out about a third of the Japanese population. Now, the quote above that is, we have strategies to slow the aging process. We essentially are treating symptoms. And this is the kind of thing that Japanese physicians did some 1,500 years ago when they were treating symptoms of smallpox, but they were not able to treat the disease itself. That is, they couldn't prevent the disease, nor could they actually reverse the disease. So treating symptoms is not enough. Being able to slow the aging process is not enough. We need to go deeper than that. One of the greatest physicians of all time historically was probably Ibn Sina, known in the West as Avicenna, and he could define plague, but couldn't understand what caused it. He actually understood that it had something to do with rats, for example, but didn't go further into fleas, let alone into a microbial inflammation. And he himself said this: in medicine, we ought to know the causes of sickness and health. He could define the plague, but he couldn't explain it really. And this is typical of our explanations for aging. We say aging is a decrease of body functions. Again, a quote from this conference. That is a definition of what happens in aging, but it is not an explanation any more than Ibn Sina could actually explain how plague worked. We understand it in a sense, we can define it in a sense, but we don't understand the explanation of it at the basal level. Now, we continue to do this sort of thing. This is a quote actually from this conference again, that what we need to focus on is freedom from diseases and, quote, successful aging. I don't think that if we went back 70 years ago, we would talk about successful polio. This is a young girl, 2-year-old from Houston, Texas, in iron lung, seen there below her. That was considered the best treatment we had for paralytic polio in those days. But it was not successful. It was not appropriate, it was not enough. Likewise, I don't think any of us would now talk about successful Alzheimer's. You don't successfully have Alzheimer's. What we need is a treatment. In the case of polio, successful treatment was not an iron lung, it was a Salk vaccine followed by the Sabin vaccine. So anytime we talk about successful disease, that is not success. There is no successful disease in disease. There is treatment. And we are not there yet when it comes to aging. Likewise, we talk about in this conference, strategies to slow the aging process. But is that sufficient to slow it? Can we stop it? Can we reverse it? If we're looking at Alzheimer's trials, for example, we've not been able to show that we can actually slow the Alzheimer's process in more than 1,100 clinical trials, registered clinical trials globally. And we certainly have not been able to stop it or reverse it. We need to ask ourselves if we can do better than that. And again, not merely slowing Alzheimer's, postponing the death by Alzheimer's and the loss of cognitive ability, but can we stop it and can we reverse the process? Can we prevent it? We talk in this conference about aging as being unavoidable. It's scarcely true. We know the germ cell lineage, for example, goes back 4.5 billion years and did not age during that entire time. And I'll come back to that. We also know that there are certain species that don't demonstrate aging. And we know that cell aging is reversible in human cells in the laboratory. The question is, can we do this clinically? So when we say aging is unavoidable, what we mean is aging is currently unavoidable, at least in certain cases. For example, again, not the germ cell, but perhaps in the body. Can we do better? Can we reverse aging? Well, this is a question that I've often wondered. And part of the problem is we tend to focus on what we think of as impossible. This is a hill in Scotland that some of you have heard of, probably none of you have been to. This is Dunsinane Hill. And Shakespeare in Macbeth, the witches told Macbeth that he could never be conquered until great Birnam Wood came to Dunsinane Hill, which clearly in his mind was impossible until Malcolm cut down much of the wood, marched on Dunsinane Hill, and conquered Macbeth. So much for the impossible. But you see what I mean? The impossibility that we look at often is on the basis of a misunderstanding. We don't understand that something could be done because we simply don't look far enough. We don't re-examine our assumptions, in this case about Birnam Wood. But the same is true historically about so many things. Example, Lord Kelvin was probably one of the world's preeminent physicists some 8 years before the Wright brothers proved him wrong. Now, Lord Kelvin knew a great deal about weight and a great deal about air pressure, but not sufficiently did he know about aerodynamics. And that allowed him to be wrong. Again, his assumptions had to do with what he knew, and his assumptions were wrong. We do this again and again. Back about 100 years ago, before the advent of quantum mechanics, we made the assumption that atoms and subatomic particles were very small billiard balls and even smaller billiard balls, and they are not. There's clearly more to atoms and subatomic particles than just being small billiard balls. There's much more complicated features to them. For example, the Schrodinger equation here and Max Born's original publication of this. So it's a more complicated issue than just what we often think it is. We often tend to then perfect yesterday's technology. We try to, for example, perfect hot air balloons or perfect billiard balls, rather than asking ourselves, have we misunderstood exactly what could be done, and move on to more advanced technologies and conceptualizations of, for example, human disease. When we come to science, this is a quote a lot of us have heard of, and I think it's true. If you can't measure it, then it's not science. And that's true. However, just because you can measure it doesn't mean it's science. It is not enough to measure things. What you need to do is understand it. We have had lots of times in medicine and history, and I'll come back to some examples, where we can measure things, but that doesn't mean we understand it. Again, Avicenna could measure some of the symptoms to do with plague, but that doesn't mean he understood what plague was about. Furthermore, in medicine, if we understand it, that allows us to intervene. If we can understand it, then we can cure it. If we understand polio, if we understand malaria, if we understand COVID, then we can intervene, but not until. So let me focus on aging for a minute. I think all of us are aware that different species age at different rates. Humans, for example, typical lifespan, perhaps 75 years. This is Coco, a gorilla who I actually was a babysitter for a year, for 6 hours on Wednesdays. I'm embarrassed to say that she has a bigger sign language vocabulary than I did. Delightful animal. She lived about 40 years. If you look at typical household pets, they tend to live about 2 decades at more or less maximum. If We're looking at mice and rats, typically a bit more than 2 years at maximum. So if you were to say that aging just happens, you would have to explain why aging just happens at different rates in different species. Likewise, if you just describe all of this to entropy, you'd have to explain why entropy works in different ways in different species. And at this point, most of us wave our hands in the air and make references to genetics, which are accurate, but not sufficient. Nor is it sufficient to say that there are just differences between species. For example, if we look within one species, human species, we find differences as well. These are a group of 30 children, progeric children, and I took them a tour of the White House about 20 years ago. And we had a delightful time. I took them places you generally aren't supposed to go in the White House. And I took pictures of things you were not supposed to take pictures of. And things were going quite well until the young man in the front row with the red baseball cap there, Sammy, next to his friend Ori, managed to sit on a pressure sensor that went to the stairs up to the private quarters. At which point the Secret Service, very politely, but quite firmly, escorted us out here in the North Portico. These children live an average age of 12.7 years, and they die overwhelmingly of age-related diseases. The ones you see that appear to have hair are wearing wigs. These children have osteoporosis, osteoarthritis. They die overwhelmingly of vascular aging, that is, heart attacks, strokes, aneurysms. Why is it that these children die of aging at such an advanced age, such an early age? Well, again, we know something about the genes involved, but that's not enough. Simply to be able to point to a gene is not enough to explain what's going on with aging and early aging phenomena. So aging is not unavoidable, as I've said. As I say, there are cells that never age at all. Not only are there children that age faster, and some species age faster or slower, but there are cases where they don't. Every one of you who's listening to this right now is composed of cells that are probably several decades old. And every one of those cells, the majority of that material came from your mother, who got it from her mother, who got it from her mother. And that unbroken line of cells can be traced back 4.5 billion years. And during that 4.5 billion years, those cells changed a great deal, but they never aged at all. So why is it that those cells never age, and yet in a matter of decades, they begin to age in your body? Likewise, if you look at mitochondria, every mitochondria in your body derives from mitochondria from your mother, who got them from her mother, and so on, back about 1.7 plus billion years ago. And during that entire time, those mitochondria never showed any evidence of aging, and yet, in a matter of decades, they show aging in your body. In fact, many of the cells in your body, I could show age-related changes, and most of the mitochondria in your body, I can show age-related changes as you're listening to me. So why is it they didn't for billions of years, and now they do? Something clearly is going on that's more interesting. This is a question I first addressed, the first time in history, actually, at the National Institutes of Health about 20 years ago, 24 years ago, almost this month. And there were 2 points I made. The first is, I said, listen, anyone who leaves the lecture and thinks you can reverse aging or cannot reverse aging is naive. An intelligent conclusion would be, at the end of this, that you don't know whether you can reverse aging or not, where's the data? And that's what I told the people at the NIH. The other point I addressed was this: what is aging in the first place? We tend to wave our hands, make vague references to entropy and genetics, but that's not an explanation. It's simply the beginning of a description. I addressed this numerous times over the past 24 years. In the first book ever on this topic, the first articles ever in the Journal of American Medical Association, the first medical articles ever on this, in which I suggested that if we could actually understand the aging process and deal with it genetically and at the cellular levels, we could treat and prevent age-related diseases. This was followed by the first and currently still the only textbook on this topic by Oxford University Press. It's a very academic book. I wish you luck reading. It's interesting, but it's some 4,700 references, and it's a tough read. And this was followed a few years ago by the Telomerase Revolution, which the Wall Street Journal called one of the best science books of the year for the general public. But it culminated also in this article that came out just a couple of months ago. I had been asked to give a talk in Washington by the Alzheimer's Association, and the key questions that we often address in Alzheimer's and other dementias for that matter is, why is it that everything works in mice, nothing works in humans? And why is it that, in fact, nothing works in humans? Why are we so incapable of preventing, treating, reversing Alzheimer's and other dementias? And it's an interesting question. And I suggested there were a couple of answers to that. One is, we share about 75% of the genes, depending how you define it, with mice. And almost all the mechanisms that we look at with regard to Alzheimer's in mice are mechanisms we don't share. They're in the 25% that we don't share. So it's small wonder they don't translate well into clinical studies with human beings. I also pointed out that while we have mechanisms, for example, beta amyloid and tau tangles, mitochondrial dysfunction, inflammatory changes, and we have methods, for example, monoclonal antibodies, what we lack is an understanding of how those targets and those methods fit into the overall disease process of Alzheimer's. In short, what we lack is a unified systems model of dementias generally, and not just for humans, but for aging in animals as well, where we see cognitive decline. Well, as a result, the editors of this journal asked me to write a paper, which I did. It was reviewed by 8 separate reviewers who were very complimentary. In fact, most of them wanted me to write more, which I did. Now, the paper came out in January of 2020, and within 2 weeks generated more than 600 reprint requests, some 24 requests to give keynote talks like this one, and considerable interest from investors. But the key points I made were these. If you have a systems model, not simply a static model, a linear model, but a systems model of how the disease process works, it offers up an innovative and quite feasible point of intervention for clinical trials, which we will pursue. The problem, put a different way, is that people tend to concentrate on the trees and they ignore the forest. They get so caught up in biomarkers and components and measurements that they stop asking themselves about how the entire forest of trees works together. I'll give you an example of this again, historically. Vatican astronomers back 500 years ago had excellent measurements of planetary motions, but they had no concept of the actual orbital mechanics involved. Their assumption was that the Earth was the center of the universe. And that assumption led to problems until Copernicus came along and suggested otherwise. It was not a problem with the trees, it was a problem with the forest. They had excellent measurements, they understood the components, they did not understand the way the system worked. Same thing is true here. Medieval physicians 500 years ago knew a great deal about plague's hallmarks. They could diagnose it, they could identify it, they could tell you all of the symptoms and signs of plague, but they didn't understand the cause. That is, the basic understanding that Yersinia pestis, in this case, was a microbe and that microbes could cause human disease. So the problem was not that they didn't have the hallmarks or the measurements or the components, or as it were, the trees. The problem was they had no idea of the system, the dynamic system that caused it. In this case, a very small bacteria interacting with a very complicated human being to cause a fatal disease. Well, we do the same thing now, if you think about it. We look at COVID, biomarkers are not enough. I think many of us, I have given global talks weekly on COVID for a while, and I can define the biomarkers, the symptoms, the signs of COVID, but that is not the same as understanding how to cure it. Biomarkers and measurements are not sufficient without understanding that it's a microbial disease caused by a complicated little virus interacting with a much more complicated human being and having consequences. We need to go further. So what we need to understand then is not the components of aging, but the entire system. We do understand the components of aging, but we need to understand the systems process. For example, why is it that germ cells don't age and many of our somatic cells do? Well, let me give you an example of the difference between components and systems. Let me introduce you to the Rolls-Royce Pearl 15 jet engine on the left and the Trent 900 turbofan engine which powers it on the right, as well as a single fan blade from that engine. A couple of years ago, a friend of mine, who actually was responsible for much of the design and implementation of these systems, said to me that I had a systems view of aging, and I asked what he meant. He said, I'll give you an example. If this turbofan blade fails from that Trent 900 turbofan engine, I don't ask what's wrong with that single fan blade. I ask what's wrong with the fan blade in the turbofan engine, in the Pearl 15 Rolls-Royce jet engine, in an Airbus 380 at 35,000 feet, flying from one continent to another. In short, that fan blade is part of a system. It's a dynamic system, it's moving all the time, and it's in flight. When we're dealing with aging, we have to go further than just ask ourselves about components or hallmarks or measurements. We have to ask ourselves how the whole system works. So let me move this to a medical context. This is a river that I think most of you know of well, probably very few of you have seen. This is the Ebola River. And as you might guess, what you're looking at on the left, and again, I've taught a course on these, are the signs and symptoms of typical Ebola virus infection. I don't include death in there, but I should. However, let me say that these are not Ebola. These are signs and symptoms of Ebola. Ebola is not signs and symptoms. It's not components. It is a very complex interaction between a complex little virus and a very complex human being that results in pathology. The same is true of aging now. Most of us are quite well aware of the macroscopic hallmarks of aging. I've listed some of them here, including declining kidney function. But while we are all well aware of these, in the mirror, in friends, as we go out in public, these are not aging. They are hallmarks of aging. But by themselves, that's not aging. Aging is a complex interaction that results in these, but these are not aging. Even if we look at the microscopic level, and I could list hundreds of these are typical ones. The first couple had to do with my knowledge about human-related dementias, but this is true of many other aging symptoms and signs if we look more carefully at the microscopic level. There are hundreds of things that occur, but these are not aging. These are simply parts of aging. They're not the system, they're the complements. And we should not confuse the two. What we need is an understanding of the dynamic process, the system, the unified system of how aging occurs, a very complex cascade of pathology, and not simply the hallmarks. So what is aging? I think all of us are aware it has something to do, for example, entropy balanced against something else. And that something else, I would argue, has to do with maintenance. So for example, if I'm looking at gardens, and these are pictures of some of my gardens, a successful garden is not a matter of not having weeds at all. It's a matter of making sure you deal with the weeds. There are always weed seeds blowing into any garden. There are all sorts of other problems that occur with gardens. But the essence of having a good garden is not the weeds themselves, it's the weeding, it's the maintenance against the forces of entropy. Now the same is true of human cells. If I'm looking at human cells, it's a matter of balance between entropy and maintenance. Well, look at the germ cell line. There is a very delicate balance between entropy and maintenance that has been maintained for more than 4.5 billion years, but the maintenance begins to decrease in somatic cells in your body and mine. And the outcome of that is the sort of changes we see in the skin of the elderly man on the left. So in short, aging is a balance between entropy and maintenance, and it's not entropy per se that causes aging, it's the lack of maintenance that allows entropy to have its sway. If we look at cells, what you find is that in any given cell in your body, there's a specific pattern of gene expression. So for example, if I'm looking at fibroblasts in a 10-year-old child, you might see a particular scatter plot that has to do with the pattern of gene expression of those. And you also see young telomeres in these cells. So if I, for example, was 9 years old, I might look at a scatter plot of gene expression in my young cells. Now I'm currently 69 years old, and the genes are the same. However, the gene expression is not. My telomeres have shortened, and partly related to that, there's been an altered epigenetic pattern. That is, the pattern of gene expression has changed. Let me use an analogy for this. Let's look at a symphony orchestra. The difference between a symphony orchestra in a young cell and a symphony orchestra in an old cell is not that there's been damage to the violin or the oboe or the piano being out of tune or the first violinist is now incompetent or has lost her hearing. That's not the difference between a young cell and an old cell. The difference between a young cell and an old cell is not the musicians or the instruments. It is the tune they are playing. And that's set by the conductor, in this case, the telomere. So the difference between a young cell and an old cell is the tune and the tempo, not the instruments and not the musicians. Let's look then at what's going on in cells. In young cells, in almost any place we look, including outside cells, any molecular pool we're looking at, whether it's the collagen and elastin in my facial skin, whether it's the beta amyloid in my glial cells, the neurons in my brain, or whether it's myoglobin or any other protein or any other molecule I look at, lipids, glycoproteins, any molecule we look at, we see that they're rapidly being turned over in young cells. And as a result, when there's damage, here signified by that little red star, it is washed out continually. You're continually turning over molecules and washing out damage. But as your cells get older, what you find is as the telomere shortens, there's an altered pattern of gene expression. The molecular turnover slows down, and as a result, you begin to get a gradual accumulation of damage. In fact, in old cells, that's so severe that the damage interferes with the function of those molecules, for example, enzymes or lipids, and therefore the function of the cell. In fact, we can look at this mathematically. This is taken from my textbook. And what it basically says is that in young cells, if there's a very rapid turnover, then the amount of accrued damage at equilibrium is very small. But in an older cell, if the turnover is a lot slower, then over time at equilibrium, there are many, many more damaged molecules. And the result is dysfunctional cells. So let's look at an example of this. This is an example taken from dementia. And what we know is that microglia, for example, are responsible for turning over much of the beta amyloid we see between cells. And there are a number of processes involved. For example, the cell produces and then exports the beta amyloid molecules. Then there is binding of them again to bring them back into the cell, uptake again, and finally degradation. This is a recycling system. It's continually being actively turned over. And not surprisingly, what happens is as the microglia show cell senescence or cell aging, they begin to slow down that rate of turnover. And we can measure it in all four of the processes listed here. And the result is a gradual accumulation of damage known as beta amyloid microaggregates. Now you might ask yourself, what about the genes themselves? Do they have an effect? For example, we know that there are certain genes that actually are protective against beta amyloid plaque and, for example, protective against Alzheimer's, and other genes that actually increase your risk of Alzheimer's disease. So as an example, let's look at ApoE2 alleles. If I have two ApoE2 alleles, then I have a much lower chance of getting Alzheimer's. And the benefit of those ApoE2 alleles is that the amyloid I make is in some sense less sticky. That is, it's less likely to cross-link and form these microaggregates. Now, as my cells get older, the rate of turnover goes down, but these are still relatively unsticky molecules, and so I have a lower risk of Alzheimer's. But if I have a double ApoE4 allele, what you find is I tend to produce stickier molecules. So even at equivalent age, I'll have a higher risk of Alzheimer's. So, for example, if I have a double ApoE2 allele, I may not have Alzheimer's until I'm well in excess of 100 years old. Whereas if I have two ApoE4 alleles, my odds of having Alzheimer's at age, say, 50 or 60 go up significantly. So genetics play a role, but overwhelming the problem is that we have this turnover recycling rate in these cells involved. And the result of that is, regardless of your genes, you begin to not only have microaggregates, but in this case, beta amyloid plaques. Nor is it just a matter of beta amyloid. The same thing occurs when we look at tau tangles, mitochondrial dysfunction, inflammatory changes, other markers involved in neural function and glial function in the brain. Nor is it simply a matter of the brain. This occurs in all your cells. So, for example, in the brain, what we see is the synaptic loss and dysfunction in dead cells. But if we look at other cells, we see the same sort of changes occurring throughout the cells. For example, the nucleus. About 99% of your aerobic enzymes derive from the nucleus, and all of those aerobic enzymes are being turned down in their recycling rate, the rate of turnover. So as a result, in older cells, you find that more and more of these cells have damage and are less functional. So they tend to produce less in the way of energy, that is ATP, and more in the way of free radicals, that is damaging molecules. Nor is that bad enough. We find that the lipid molecules that contain those free radicals within the mitochondria themselves are being turned over more slowly. And as a result, there's oxidative damage to those lipid molecules, and so they're leaky in membranes. And that's also true of the cell membranes and of the nuclear membranes. Also, once these free radicals leak through the membranes, scavenger molecules, for example, superoxide dismutase and catalase, are also being turned over more slowly. And as a result, they're less effective. So there's more and more free radicals that escape scavenging once they get outside the mitochondria. The result is more damage. And in fact, most of your molecules you simply recycle, but there's some you actually repair, specifically the nuclear, the genes in this case. And in fact, there are four sets of enzymes responsible for repairing DNA damage. That is detection, excision, replacement, ligation. Now, in every one of you, in about the 20 minutes that I've been talking, has had damage, DNA damage, within every single cell of your body. And almost without exception, you have flawlessly repaired it. However, as you get older, the turnover rate of these detection molecules, excision molecules, replacement, ligation molecules go down. So not only is detection slower, but that's multiplied by excision slowing down, replacement slowing down by ligation, and then in short, that's an exponential process. So as you get older, that's an exponential increase, not only in DNA damage, it's not repaired well, but consequently in malignancy, that is cancer. And it doesn't matter in some sense how old you are, the question is what species you are and whether your cells are aging. So whether you're 2 years old in a mouse, or 100 years old in a human, you have this exponential increase in the rate of DNA damage and the rate of cancer. So it's normalized by mammalian lifespan, not simply by years. In short, your rate of cancer is not strictly speaking related to your exposure to carcinogens. It's related to your ability to deal with the damage caused by carcinogens. And that ability to repair damage, goes down with age exponentially. So aging cells are responsible for most of what you and I see as cancer, particularly in adulthood. Now, I might have given you the impression telomeres cause aging, which they do not. Telomeres no more cause aging than we could say that genes cause evolution. Genes are a key part of evolution, but they don't have to cause evolution. They're simply a key player in evolution. Likewise here, telomeres don't cause aging, but they are a key component of it. Likewise, telomere length is irrelevant. However, the change in length is critical. I'll give you an example. There are mice that have telomere lengths at birth 10 times mine, and yet they have lifespans 40 times shorter than mine. It is not the length of telomere, it's not the absolute length, it's the relative length. It's the shortening as it causes changes in gene expression and changes in protein turnover and other molecular turnover that result in aging. So telomeres are not the cause of aging, but they may in fact be a key place that we can intervene. Likewise, telomere length doesn't matter, but that change in length is critical, and it predicts lifespan in almost any species we look at. Now, let me look at a more complicated view of this. This is taken from my recent article on this. It's figure 7 of that paper I published on dementias. And what this really says is there are a number of factors that we know about upstream that increase your risk of aging, and there are a number of biomarkers downstream that we associate with aging. Example, we know that, for example, head trauma increases your rate of of Alzheimer's and of Parkinson's disease. We know that trauma to your knee increases your rate of osteoarthritis. We know that exposure to toxins or chemotherapy increases your rate of aging, of cell aging. Certain genes can increase the rate of perceived or clinical cell aging. Likewise, we know that hypertension and diabetes, for example, increase your risk of stroke, that is vascular aging. And likewise, if we look at hormonal factors, radiation, abnormal microbiome, or in fact, infections, we find all of these can accelerate the rate of aging and therefore cell division, shortened telomeres, altered gene expression, and cell dysfunction. And if we go downstream, likewise, we can see all of these different biomarkers, and there are hundreds more we can look at. We all associate these with age-related diseases like beta amyloid plaque, slower lipid turnover, altered patterns of DNA repair, and so on. But none of this matters. This is in some sense irrelevant. This has to do with why we age. But from my standpoint, the key question is not why do we age, it's where is the single most effective point of intervention, clinically and financially. That is, how can we make these things better? Well, what we know historically is we've tried to intervene in numerous spots. For example, we have tried to deal with trauma, but even if I get rid of all trauma, you still show aging. We have tried to deal with things like hypertension and diabetes, but even if I totally normalize those, you still have the risk of stroke. Likewise, if I prevent infections or if I prevent ultraviolet damage to your skin, you still show aging in almost any target tissue you look at. So we find these are inefficient targets. It's not that we don't want to intervene in them, it's just that they're not good enough. Likewise, downstream. When we look at the targets we have downstream, as an example, beta amyloid, no matter what study we've looked at with regard to beta amyloid and Alzheimer's, we've never showed that it has a significant effect on the course of disease. And the same is true of all the other downstream targets. These are not efficient targets. Clinically, the most efficient target is almost certainly cell aging itself. It is the optimal target in aging as a systems process, not as individual components, but as an overall view of intervening in the system itself of aging. And in fact, this works out very well. What we find is enormously effective. We find that if we target telomerase therapy against human cells or human tissues, we can actually reverse aging in human cells. We can reverse aging in human tissues. And we do this with organisms. Well, the first publication of a paper showing that was 2011, the second one in 2012. And there's good solid data showing that, in fact, we can reverse aging to a degree, at least, in organisms. And in fact, when it comes to cognitive decline, we find that we can correct the function of senescent cells, restore neural function, and actually reverse cognitive decline in animals, which is why we intend to take this to human trials within the next year or so. Well, let me step back for a moment and put this in historical perspective. If I ask what are the most important things that have ever been accomplished in the history of medicine that made a difference in human lives, really improved real human lives, what are those things? They're not technical incremental advances like robotic surgery or heart transplants or a fourth generation antibiotic or the most recent statins. Those tend to have some effect, but they're not the most effective thing we've ever done. The most effective thing has been a conceptual revolution. For example, the understanding of microbiology in human disease. This has allowed us to do things like have hand washing during delivery of babies, which drastically lower the fatality rate, both the maternal and the neonatal fatality rate of people during birth. Likewise, the very first sterile surgeries or the original smallpox vaccination or our first antibiotics or polio vaccinations, these are the sort of things that had an enormous impact on human lives. Not only did they drastically improve the quality of human life and the length of human life, but these overall lowered the cost of medical care. Example, in 1950, there were predictions that many nations would be medically bankrupt by 2000 because of the cost of treating polio victims. For example, the iron lung I showed you. For example, rehabilitation therapy. These are expensive. Currently, the global cost of treating polio is less than 10 cents per patient. However, I think that the biggest revolution in medicine, in the history of medicine, is something we're about to undergo now, and that is our understanding of the aging process, because it will allow us not only to cure and prevent age-related diseases, but to improve human lives at a basic, fundamental human level. Moreover, it will lower the cost of medical care, because we will be able to actually prevent and treat these diseases, not simply by putting people in nursing homes and treating symptoms, but actually by curing and preventing the disease. And this will lower the cost of medical care globally, nationally, and personally. In short, I'd like to summarize by saying that once you understand disease, you not only can stop the disease, but you can actually improve human lives. And this is where we need to be, not simply by dealing with components or hallmarkers or biomarkers or pieces or measurements. We need to understand the basic process that underlies age-related diseases so we can actually improve lives. I'd like to thank all of you and welcome you due to what I think of as our remarkable and shared future as we move forward to be able to cure disease. Thank you again. Good luck. I hope you enjoy the rest of the conference. Good night.